When we or a loved one are in need of health care, there's a universal desire for safe, effective care and treatment. We also hope, and certainly expect, that the care we receive will be delivered with kindness, compassion, and respect, and that healthcare information will be provided in a way that we understand. We trust that our human needs won't be overlooked in treating our medical needs. For those of us who followed a calling to work in healthcare, we find strength and fulfillment in the desire to not just alleviate suffering, but also to help others live full, rich lives. The COVID-19 pandemic has been an immense stress for our healthcare systems. Healthcare providers valiantly provided care in the face of staggering challenges and at their own personal risk. But where many organizations fell short, though, was in balancing that focus on medical needs with the attention to human needs. As a result, lives were lost to the effects of social isolation and from people delaying essential care procedures and preventive care because they didn't want to be separated from their family. The trauma and moral distress of providing care under incredibly challenging circumstances has caused many needed caregivers to leave healthcare. We saw community partnerships were put on pause, and in many organizations, essential family caregivers and patient and family advisors literally became outsiders. Here at Griffin Health, we were fortunate to maintain many of our Planetree principles throughout the pandemic, thanks to our skilled and dedicated caregivers. We maintained healing partnerships by quickly transforming a section of our emergency department and a hospital wing into a safe and secure area to treat infected individuals, and mobilized effective strategies to screen hospital patients, visitors, and our caregivers in order to provide patients' loved ones with visitation opportunities. Our primary and specialty care providers attained a sense of human interaction through telehealth services to their patients. While telehealth allowed us to continue to inform and empower individuals with patient education, Griffin as a whole developed new partnerships with our community and stayed through robust COVID-19 testing and vaccination programs. So where do we go from here? As we emerge from the pandemic, I hope that as a global person-centered care community, we can use what we've learned during these past 18 months to prepare for any future crisis, but also that we continue to leverage the advancements in patient-centered family engagement that emerged as pandemic solutions and move to firmly embed them in how care is delivered from here on out. Person-centered care provides us with opportunities to advance care. It's the intersection of quality, compassion, and partnership, all converging around the human experience of health and well-being. And we know, because the evidence bears it out, when we're all doing person-centered care well, it improves not only quality of care, but quality of life for our patients, for their families, for the healthcare workforce, and for our communities. We now understand better than ever the connection between engaging our patients and their families as our partners and improved clinical outcomes, as evidenced by the international coalition that developed the guidelines for a compassionate approach to family presence during the pandemic. That knowledge has fueled aspirations of person-centeredness around the globe. It's been immensely gratifying and so encouraging to see person-centered care principles embedded in national healthcare policies, in accreditation standards, in educational curricula, and most importantly, in the cultures and care delivery practices of healthcare organizations around the world, including the pioneering medical centers and healthcare clinics in Latin America that have brought the model to this region. COVID-19 changed the relationship between patient and healthcare provider. The pandemic forced the industry to figure out how to keep people safe while ensuring they got the care they needed. And in many cases, that meant finding ways to care for them outside the hospital or health clinic. Delivery models like telehealth, hospital at home, remote monitoring, self and mobile collection for lab tests all proved to have distinct clinical and public health advantages. Not only that, For many patients, these approaches allowed greater flexibility, choice, and convenience, which meant people were more apt to get the care they needed, and they were more apt to come back for future care needs because we made the healthcare experience easy and frictionless for them. How then, as we come out of this crisis, can we retain that level of responsiveness and consumer centricity to meet people where they're at and deliver care in ways that fits into their lives? We need to revisit the role and function of hospitals and other traditional care settings. Creating healthy communities is an essential element of person-centered care. And the pandemic distracted us from our focus on healthy communities and added other negative influences to health, including social isolation, domestic violence, substance abuse, and economic strain. Therefore, as we emerge, we need to design and support a healthcare ecosystem that draws on multiple capabilities and resources. Whether it's creating healthy food distribution to address food insecurity, providing transportation so people don't live in isolation, or deploying community health workers to check in on living conditions and identify signs of abuse, community partnerships will be instrumental in meeting patients where they live their lives and in designing supports and services that fit. We're shifting our focus from traditional settings where care has been delivered to moving into the places and spaces where life happens. What could be more person-centered than that? But as much as we've all needed to adapt and respond to the volatile healthcare landscape, there's an important constant that we must not lose sight of. At Planetree, our model of person-centered care hinges on understanding and responding to what matters most to patients, to family caregivers, and to healthcare workers. And when it comes to these preferences, we know that healthcare consumers appreciate and want convenience, exceptional customer service, and access to providers and information. They also want care provided in a comfortable environment with minimal waiting time. All of this matters, but what matters most are human connections. In a 2020 study of healthcare consumers, the top factors for an ideal health experience all centered on this theme. 44% of respondents said what makes a healthcare experience ideal for them is a doctor or healthcare provider who listens and shows they care. 42% said a provider who spends time and doesn't rush. As healthcare systems continue to invest in digital capabilities, let's not overlook the need to shore up skills and competencies to ensure constructive, caring interactions, whether those occur face-to-face or through a tablet. It's unrealistic and it's unfair to expect all caregivers to be naturals at remote care delivery and virtual communication skills. And yet, these skills will be key to providing successful person-centered care from this point forward. To make sure our people have what they need to deliver optimal care, we have to invest in skill building in addition to the necessary technology infrastructure. Not only that, the quality of these interactions and care overall shouldn't vary based on someone's background, identity, or traits like race and gender. And yet, we know that certain implicit biases exist in healthcare, and those biases have detrimental effects on health outcomes. This is not to say that interactions and care will be delivered the same way for every patient every time. In a person-centered approach, care and treatment plans are personalized to address each individual's background, identity, and personal history. But those two are competencies we need to cultivate within the healthcare workforce. Uncovering these underlying biases in care delivery and supporting our staff to find ways to address these in sensitive and effective ways is fundamental to delivering quality care and compassion and partnership. So as we look to the future of person-centered care coming out of the pandemic, we have the opportunity to course correct and to reestablish those person-centered practices that were put on hold. And we can do that in a way that firmly establishes that person-centered care does not come at the expense of safety, In fact, by welcoming family caregivers into our facilities to actively participate as care partners, we're actually positioning our patients to achieve better outcomes. By supporting patient autonomy through the use of apps and self-monitoring tools in the comfort of their own home, we're empowering patients to more effectively manage their care and adopt healthy behaviors that reduce the need for hospital visits. And by bringing care into trusted places and communities where people live their lives, we're taking quality and safety to a higher ground by ensuring people's human needs and their medical needs are well attended to. As a community practice then, our call to action to each other must be, how can we do this more? Throughout Latin America and around the world, how can we continue to demonstrate through our practice that it is possible and better for all of us to balance high-quality, safe clinical care with compassion and partnership? How can we continue to represent these person-centered values to patients, lead our organizations, and support our hardworking staff? These are complicated times, with many complex challenges for all of us to wrestle with. I, for one, am encouraged to know there's a global Planetree community continuing to advance person-centered care even under the most challenging circumstances. I'm so grateful for all I've learned from my colleagues in Latin America, and I look forward to continuing to share Griffin's experiences and our lessons learned as you continue in your noble mission to advance patient and family engagement and humanize care throughout your region.